So good morning, everybody, whosoever is here. So I'll invite Dr. MS Ma'am to come on the dais, and we'll be starting with the Teaching the Trainers program. So over to you, ma'am. Yeah.
A very good morning. A warm welcome to all of you. So hope we all can learn together and from each other. So I'd like to think that this program is actually historic in many ways. That is, this is the first time, and I've been curating this program for, I think, about 15 years maybe. So it's but the first time ARC, Ophthalmology Foundation, and YOSI have come together, keeping education as the theme. The first time we have debates in education with many veteran teachers who are going to be judges. The largest number of education keynotes in one session from education stalwarts. First time every single premier institute is being represented. So many Ophthalmology Foundation members participating and have come a day early. So thank you. Thank you, Pranesh. Thank you, Helena. And thank you, Carl. He'll be here shortly. So we'll stick to time as the hall has to be handed over. We hope we can have an interactive forum going on a platform that is comfortable after today's program that is completely education focused for the ophthalmic teachers. We can continue discussions during our breaks too. Thank you once again. Special thanks to Carl and Helena for being here, and for Pranesh, who's come from the UK, right? And Devakant for enabling a large YOSI representation. And of course, Dr. Prashant Bhavankule, ARC chairman, for the opportunity to create personally a dream program for me. Thank you. Any other deliberations before that?
Introduction session.
Carl is speaking, and I think Prashant has to speak, right?
Yeah. Me, Dr. Prashant, and Carl.
So why don't you speak? Yeah, I'll invite you.
Okay.
Next up, I invite Dr. Devakant Mishra, President YOSI, to talk about YOSI's partnering in this program.
So good morning, everybody, and we are so thankful to all of you to be here so early in the morning on day 0. So it gives me great pleasure to welcome all of you to Teaching the Trainers program, and I request, madam, that it should be Teaching Tomorrow's Trainers program. Yeah. So tomorrow's teachers. Yeah. So this is a very powerful initiative by Academic and Research Committee, which is headed by Dr. Prashant Bhavankule, sir. I think he'll be here in some time. And this is a collaboration between ARC, YOSI, and Ophthalmology Foundation. So I believe this is not just a session. It's more like a shared vision that all these three bodies share. And it's a very important program because as ophthalmologists, we keep on learning new things. And for young ophthalmologists also, it becomes a responsibility to teach others, mentor a few people, and to do that in a very structured way. So hopefully this program will let us do that. At the core of Young Ophthalmologist Society, the whole team, all the members, I think teaching is one thing that we are very passionate about, and the way we do it is that identifying teachers and our younger members who are passionate about this, giving them platforms, giving them the structured skill set that they can acquire, and exposing them to the programs like these so that they can be part of this. I hope this is being recorded somewhere so that other people can benefit from this. So I wish everybody good luck for this program and hope to learn new things. Yeah.
Thank you, Dr. Devakant. So since we have the luxury of time, which is not often in such programs, so I request the participants to introduce yourself. The mic is there. Please introduce yourself.
Very good morning to the chairs and all my friends. I am Dr. Chandrasekhar from Aravind Eye Hospital, Coimbatore, academician for more than 3 decades. Thanks.
Thank you.
Good morning, all. I'm Dr. Soni Sanha from Patna, Bihar. I'm at AIOS Patna as an additional professor there. And I've been attending this teachers program ever since its inception. And I have a great deal to carry home every time that I attend it. It's been really wonderful. I'm heading the vitreoretinal unit and uvea unit at AIOS Patna.
Thank you. Lovely. Thank you.
Good morning. I'm Dr. Jigisha Sharma. I'm from Mumbai, and I'm the head of department and ophthalm teacher at Rajawadi Municipal General Hospital, which has DNB students since the last 10 years.
Okay, great. Thank you. Yeah. Since we have time, we can all get to know each other.
Sure. So I'm Avinash, and I'm a vitreoretinal surgeon by training. In infectious uveitis is where I usually dwell in my research interest. I've been heading the Academy for Eye Care Education at LV Prasad from 2016 onwards, and we gather the entire segment of eye health professionals, and ophthalmology is one small part of it. And looking forward for an exciting meeting this morning.
Thank you. Thank you.
I'm Sri Priya. I've been heading the community wing of Shankar Nethralaya for the past 15 years, and I've been there for more than 2 decades. I was involved with the surgical teaching and training and sharing the load with Meenakshi.
Thank you. You could, yeah, please introduce yourself, Ranish.
Hello everyone, thanks for joining us today. I know it's not easy to join on the first day, first talk. It's always a challenge for both speakers and audience. I'm very grateful that you are all here. I'm Pranesh, one of the fellows from Moorfields. I was Arvind product. I'm still an Arvind product, and I'm a part of the Ofthal Foundation. That's why I'm here. Thank you so much for joining.
Yeah. And thank you, Pranesh. I'm sure you know he runs this fantastic YouTube channel called King's Crux. It's a great resource. I'm so excited every time I see something he has uploaded, and I feel I want to be a student again. So thank you. Thank you for continuing that. Good morning. Please, introduce kariye. Welcome. We're just introducing the participants. Mic आप उठा के दे सकते हैं उनको? उसे निकाल के.
First of all, I am thankful to Meenakshi ma'am. She taught me visual rehabilitation at Shankar Nethralaya, Chennai. In fact, I was the best surgeon of Mahavir Nethralaya, Kankarabagh, Patna. But a brain hemorrhage made me paralyzed. So I started a new career of visual rehabilitation. Meenakshi ma'am taught me very well visual rehabilitation. Now, thanks to her, I can make people smile. Those who have lost all hopes of seeing again. So thank you, Meenakshi ma'am. Thank you very much. I'm Dr. Ashwini from Patna.
Welcome,
and
welcome,
Soni
Dr.
ma'am, thank
Ashwini.
you. You always boosted my morale. She's from Patna.
Yes, yes.
So she always sent me the patient. First patient she sent was she was from him. So thank you very much, Meenakshi ma'am. I wanted to meet you. Thank you.
Welcome, Dr. Ashwini. Dr. Helena, would you like to introduce yourself?
Greeting. My name is Elena Flip, and it's an honor and a pleasure to be with you. I've been involved in health professions education since some time, especially in continuing professional development, and within this area encompassing, I would say, all or most of all domains in health professions education. I'm currently the chair for the simulation-based education and for the continuing professional development of the Ophthalmology Foundation, and I'm very, very honored to be here today and to share some insights with you. And learn more, because I feel an internal, lifelong learner. Thank you. Thank you, Professor Meena.
Thank you,
Thank
Helena.
you, Professor
I look at Helena as the queen of CPD and queen of simulation training. Thank you, Helena, for coming all the way from Portugal. Thank you for being with us a day early. Please introduce yourself.
Good morning, everyone. I'm Dr. Pooja Bang from AIOS Nagpur. So I'm heading the department there, and we've started from scratch it's a 6-year-old institution now, and we've started both the MBBS curriculum, the PG curriculum, and soon to start the MCH also this year. So I've been deeply involved with the curriculum making, the actual training of the PGs, the roster making, and I stick to medical colleges all throughout because that's what I love, teaching. And being part of the Guru Sangam and the other initiatives also, I've been part of the, I've done 2 or 3 CMETs, and so I love teaching, basically. That's why I'm here. So try to have some forms of innovations, like my newest one is to use storytelling in clinical teaching. So we're trying all this stuff. Thank you so much.
Thank you. Thank you so much. Please introduce yourself.
A very good morning to everyone. My name is Dr. Satbir Singh Paura. I am from Jalandhar, Punjab. I have a keen interest in cataract and refractive surgery, and I'm, I suppose, the youngest one here to learn from this August gathering. Thank you so much for this opportunity.
Good morning. You walked right at the perfect time to take the mic, introduce yourself. We're just doing a round of introductions. Yes.
Hello everyone, I am Dr. Apurva. I am a retina consultant at Joshi Eye Institute at Hubli, which is in North Karnataka. I always look forward to this workshop, like I told you, and this is one of the highlights of the conference for me. I've been attending for the last 8 years, and I'm very happy to be here.
Thank you. Thank you. Thank you, Apurva. So I just wanted to make sure that we're not only on time, but we're not ahead of time either. Because just in case there are people who are walking in saying, I'll come in after the introduction. So I thought it would be prudent to just wait a little bit. Let's take, since you're going to be the next speaker, can you take a few minutes, and I take the liberty of asking you this. So Dr. Pranesh was awarded a academic fellowship, am I saying it right? Teaching fellowship at Moorfields. And he's been doing this for 2 years now? It's a proper, now it's a clinical fellowship, but it started off as a educational fellowship. So could you just share with us, maybe in the next 5-10 minutes about what is this fellowship? How did you go about getting it? And what change did it? Because there are very aspiring teachers here, young teachers here from Jalandhar. So maybe they can, can follow you in your footsteps. Can you share with us? Yeah, thank you.
Hello. So this is it's called a clinical teaching fellowship. It's basically another NHS job, but it is more aligned with teaching. 50% of teaching, 50% of clinics. The unique aspect of this fellowship is that there is a protected time for teaching, and you are paid for teaching students. So it's teaching undergraduate as well as postgraduate students, but more focus on the undergraduates. So the application is by normally applying for the job, and but before that we have to make sure that the professors who are there at Moorfields know you and know your work. That's how the contact was made, and this was arranged. But what I learned from there is something very interesting. The onus, the focus is on the students, as we always maintained, because there is a hierarchy. There is always this levels which has been passed through generations, where we have the professor on the top and we have the students down there, and students always take the back seat. It's always the professors who have the dominating position. But then there was a reversal of roles. There the students had the say. Students asked what they want, and we gave them what they want. This can go either way. It's kind of a debatable topic. I hope this is one of the debates which we can also address today. Who should be on the top of the... But it's all about having the same platform, understanding each other. No one is on the top, no one is at the bottom. It's going to be the same. That's something which I learned, because students give feedback about the teachers. I don't think this has ever happened in India. That's one thing. But interestingly, that made us better teachers. Because when we get the feedback from the students, we understand how backward we are in our thoughts. the fresh young minds know much more, and they really make sense. It's not that they are absurd. They know what they want, and it's really justified with what they want. I think that's one lesson which I learned. And we have an exclusive department just for education, and the teaching time is protected. They're being paid for that. I wish we need to have more such clinical teaching fellowships in India as well. We have a cataract fellowship, we have cornea fellowships, but do we have a teaching fellowship in India? I'm not sure, I may be wrong, but if that can be implemented, it'll be fantastic, because that will nurture more and more teachers for the future. Because one thing which is stopping the young ophthalmologists from entering into teaching completely is the financial aspect of things. Teaching is not lucrative. When we go for a job outside, what they want is how many phaco's have you done? That's the question they ask. They don't ask you how many classes have you taken. Right? So that's a food for thought. That's something which we can think about in future. Yeah. Any questions? Yeah, thank you so much.
I'd like to just add that in the nursing profession in India, it's already divided, but it's actually exclusive, mutually exclusive. So the nursing teachers are not nursing clinicians. So that's what happens in the government setup. So I would, opt or would like to maybe suggest more of an, something in between where you also have a clinical, like a 50%, like you said, and some time for teaching, dedicated for teaching, where we can prepare our lectures and not just have to just land up on the stage and talk, because sometimes we just don't get time. You're in the middle of a bustling OPD and suddenly someone reminds you, oh, you're expected there at the lecture hall. Usually that's what happens with us. So, but whereas in nursing, the nursing teachers, tutors, they stay at the nursing college, and the clinicians, they are in the ward. Very few times will it overlap. So I would just say, like, this in-between thing, it's not that it doesn't exist in India, it exists in the medical field, but in nursing, not in medical.
Thank you.
And I think you're absolutely right. I think two things that, like you said, Pranesh. One is the protected time, and the second is financial, compensation or reward, or whatever you want to call it. These are two key things.
That's very true.
Yeah.
And also what they do is they are sponsoring for a 1-year PG certification program in medical education. Because just because we are surgeons, we are doctors, doesn't mean that we are teachers. Both are different skills altogether. And I don't think as MBBS students, they have a curriculum for medical education. Maybe things have changed, I'm not sure. But still now, I don't think we have an exclusive subject on medical education for undergraduate students. That has to be there at a very early stage, so that we are nurturing the teachers right from medical students. And that's the way forward. And by sponsoring for this PG certification course, you are getting a degree as well. And not just that, you are learning how to teach, how to develop a curriculum, which is a completely different skill set from being an eye surgeon or an eye doctor. That's something which we can also think about. Maybe in future, we can develop a medical education program for undergraduates, even for postgraduates.
There's a Teachers of Tomorrow for postgraduates, which AIOS has introduced since the past 2 years. So, in fact, my students did participate.
Well, that's
Teachers
nice.
of Tomorrow.
Very nice.
The idea actually started with Karnataka.
Yes.
Yeah. Krishna Prasad was the first one to start it.
It's going on for the last 12 years in Karnataka.
Students simply love it.
Yes.
Nice.
The way they present is totally different from how they would present a normal seminar.
Nice.
But the thing is that all has to translate into people taking up education, and that will
Yes.
happen only if those two things are satisfied.
I think the focus right now is to win in Teachers of Tomorrow,
Correct.
the winning team.
Yeah.
So I think, like you said, it has to translate to better teachers of tomorrow also.
But it is also done as one benefit, one good, and that when we see our students teach and the innovative techniques they use, we have to rethink the way we, our normal lectures. Are they getting boring? Are we interesting enough? So these are the things we need to rethink and innovate on our teaching skills as well.
The very fact that you're here speaks volumes that you're already wired like that. You're already pro teaching, and you only need a little tweak. That's all for updated techniques. Please welcome. Please come. Mic unko de dijiyega. Please introduce yourself. We're just making a round of introductions that we start. Thank you, Pranesh. Thank you.
So I'm Dr. Panna Shetty from, I'm a fellow actually in Nayan Netralaya.
Lovely. Thank you. Which fellowship?
Phaco-refractive.
Welcome.
I'm Dr. Deepthi. I'm a fellow as well from Narayan Nethralaya, phaco-refractive.
Welcome.
Ma'am, the other thing that Pranesh said about the role reversal kind of a thing.
Inko de dijiyega.
And it's a very cultural thing in India where a teacher is a guru. You have to submit to the guru to learn something. So to incorporate something like what you said needs a more of a cultural shift. So how do you suggest that, apart from the initiated ones who are here, how about the other ones?
So taking feedback from students about the faculty is something I tried at the insistence of Dr. Badrinath about 17 years ago perhaps in Shankar Nethralaya. He also, and so it was collected as an anonymous feedback. And he asked me to present it to the consultants. And I did not mention any names, but I did mention a few names where there were compliments were pouring because I thought that needs to get out there. For the others, only the comments were up there, what all the students said. There are still colleagues who don't talk to me. Okay, so it doesn't go down well. It doesn't, like you said, or I think Pranesh said about training the teacher. You're not, because you're a skilled surgeon doesn't mean you're a good teacher. Even to teach nursery, LKG, UKG, you have to undergo teacher training. But you do not have to undergo teacher training to teach doctors, to teach residents. That's the irony. Okay, so, but you were asking, so so after that, it is a structured questionnaire. It was adapted from the Maastricht questionnaire. It's a Likert scale. So I have a graph, and I give the graph with very few comments. Again, anonymous. But it's possible to collect that reverse feedback, faculty evaluation feedback in a large program. People always ask me, if I have 2 residents in my program, how do I collect anonymous feedback? People will not give you feedback. It will not happen. So it has, like you said, has to have a cultural shift. But I'm still optimistic that it will happen.
At Arvind, for paramedics, we have a program, madam. Pranesh is aware. It's called AIOS Shiksha for across Arvind Eye hospitals. Apart from the classroom teachings and hands-on workshop evaluations, there is a site where every student will undergo a self-learning, paced learning and training. This is the assessment also in a time. Not only that, every teacher has to undergo that examination to be eligible to become a teacher. So there is equal importance to the teacher as well as all the data are all same and the PowerPoints are same and universal type of teaching across the system. I thought I'll share with you.
Hi, good morning everyone. I am Dr. Yamini Priya, HOD of Ophthalmology at St. John's Medical College, Bangalore. So teaching is part of life.
Yes. Welcome.
PG. Thank you.
Yes, thank you. Welcome. I think we're getting into the next session. I'm almost there. So thank you, Divakant. We will listen to we'll hear Dr. Karl Golnick when he arrives. Welcome, Kaushik. Please introduce yourself. Just saw you, a glimpse of you walking in. Please.
Dr. Kaushik, part of the Shankar Eye Foundation India.
Well, come on, say a little bit more. At least tell them you were my fellow.
I was your student in my pediatric ophthalmology fellowship.
Thank you. All right. So for the next session, which is titled Workshop Teacher's Toolbox for the Busy Clinician Educator, the moderator will be Dr. Pranesh. And yes. Maybe I'll go outside and find the other panelists.